Well, hello and welcome to the Goodbye Heart Disease webinar. I'm Dr. Tabor Smith, and obviously today we're going to be talking about how to prevent and correct heart disease, one of the biggest killers in the United States. I just want to thank you all for being here. We've got a packed house tonight, a lot of people on the line, and I just want to do justice for you guys. I got a lot of great information here I want to share with you. Let me share some statistics that I actually found with you first, and some of this is going to actually blow your mind. Some statistics show that 1 in 3 American adults have cardiovascular disease right now. 1 in 3. Every year, almost 1 million Americans, that should be capitalized, I apologize, almost 1 million Americans have their first heart attack, and of those, almost 200,000 die. And I've seen numbers that were actually bigger than that. There were up to 50% of the people die from their first heart attack. And which in case, heart attack is sometimes the very first symptom you ever have, so you don't even know you have heart disease. Some statistics also say that cardiovascular disease is the leading cause of death in America, again capitalized, and their numbers indicate that every 37 seconds another person dies of cardiovascular disease. Every 37 seconds another American dies of cardiovascular disease. And ladies and gentlemen, heart disease touches a lot of families across the United States, across the world. I understand that. But it's touched my family as well. My mom, you may or may not know, my mother passed away at the age of 47 from a heart attack. And she had a rough life. She had a lot of health problems growing up. She was diagnosed with type 1 diabetes when she was just 8 years old. And if you're diabetic, you know that you've got to pay even closer attention to your health than just the average person. And so as she grew older, she was told that she shouldn't have kids. She lost her first 2 babies trying to have me and my brother, and thank God me and my brother were healthy babies when we came along. My mom, as she got older into her 30s, she developed renal failure, so her kidneys completely shut down. Eventually, she had to go on dialysis, where she would travel 3 times a week to get all of her blood pumped out of her body into a machine where it's cleaned and pumped right back into her body. She continued to do that. In her 40s, her diabetes got so bad that she developed neuropathy and Charcot joint, and if you know what that is, it's a breakdown of the nerves in your legs, and your bones become real chalky-like, and they break very easily. So she had to go into a wheelchair in her 40s, and she died at the age of 47 from a heart attack in her sleep. It wasn't even enough of a symptom to wake her up, but that heart attack took her life at the age of 47, and she was taking, when we went in, we looked at her medications, we found 27 prescription medications. And so that's why we do this prevention, and that's why we do this how to correct heart disease naturally, because sometimes you get stuck in that cycle, that whirlwind, that tornado of drug after drug after drug, and you can't get out of it. And so we're going to give you some weapons, some ammunition that you can start to use today to help prevent heart disease further in your family. And if you do, unfortunately, have heart disease already, to help you start to correct that, just help your body function the way it was meant to function. And you have an innate intelligence, and it heals. The first thing I'll start with, and I start with this all the time, is man, you got to get your spine checked. And I don't just mean once. You got to get it checked regularly, and you got to get it adjusted regularly, because your nervous system controls everything. Your brain sends a message to your heart and tells your heart to beat, and it keeps your heart healthy. And this picture, the reason I put it on here, is after I graduated from chiropractic school, I went back home and I looked at all the hospitals. I went around to each hospital that my mom had been to, because I gathered her imaging and her x-rays, because I wanted to look at her x-rays and I wanted to see what her spine looked like. I know she hadn't been going to a chiropractor, but I knew her spine must have been a wreck if she had that much problems with her health. And I gathered up over $100,000 worth of x-ray imaging, MRI, CT scans, brain scans, and I went through them one by one, each one of them, and not one picture showed her spine. There were x-rays of her knees, of her ankles. There was x-rays there were CT scans of her organs and a brain scan in there. But she didn't have back pain. That was bad enough for them to do an x-ray of her spine whenever she went in there. And that's why our mission is to check as many spines and educate as many minds as we possibly can in our community. Because it's important that you get your spine checked. I don't care if you have back pain or not. It's important that you get your spine checked and your nervous system adjusted so that it's working properly, so it can control the rest of your body. So we'll go ahead and we'll move on. We're going to move into what is heart disease. Well, heart disease is basically an umbrella term, okay? It's a term for any type of disorder that could affect your heart. So it can mean a lot of different things. There's a lot of different diagnoses, and I'm not going to go into all these diagnoses. It could be, you could be suffering from angina, arrhythmias like tachycardia, bradycardia, premature contraction, fibrillation, congenital heart disease, coronary artery, dilated cardiomyopathy, myocardial infarction, heart failure, mitral valve regurgitation, mitral valve prolapse. All of these huge words are just diagnoses. They're just words that men have given to each type of symptom, and they're all under an umbrella called heart disease. And so we're not going to go into the specifics there. I'm not so worried about each specific diagnosis as I am in how you can restore health to your entire body, to your entire cardiovascular system. Just like a cut on your hand, your body has an intelligence, and that cut on your hand will heal with time. Heart disease, if you give your body what it needs and you remove the interference, your body's amazing. It's self-healing. It's self-regulating. There's a miracle in every person. And you were designed to be healthy. I truly believe that. And I'm going to show you some things naturally that you can do that's just going to maximize that innate potential that's already in your body for healing. We'll be talking about heart disease, and really we'll be talking about cardiovascular disease more specifically. Cardiovascular disease refers to the disorders of the blood vessels and the heart, while just the heart disease refers to just the heart. So because one very common cause of cardiovascular disease is arterial disease, such as atherosclerosis, that's one of the most common causes of cardiovascular disease. We're going to be talking a lot about that. To understand cardiovascular health, guys, you got to take a close look at what we call the endothelium of the blood vessels, all right? The endothelium is the skin that lines the inside of all of your blood vessels, and this is so, so, so important. So a healthy artery or a healthy vein, the endothelium is smooth, the blood flows freely, the artery is flexible, it easily widens or dilates, and that's a function called vasodilation and vasoconstriction, and that happens naturally in a healthy blood vessel, and if you're cardiovascularly healthy. See the left side there, how smooth that artery is, and the blood flows smoothly through there. On the right is the unhealthy artery, and I'll show you how that builds up and how that happens. In fact, I'm going to take you through 16 steps of how cardiovascular disease happens inside your body, and how arteriosclerosis, the most common form of cardiovascular disease, or basically an unhealthy cardiovascular system, how that can develop. So step one, the endothelium, remember that skin, that lining on the inside of your artery is damaged by it could be a number of things: high blood pressure, cigarette smoke, saturated fat, things you eat, things that you're not exercising, sedentary lifestyle. Those types of things can damage that skin on the inside of your cardiovascular system, on the inside of your veins and arteries. And then what we call, quote-unquote, right, bad LDL cholesterol becomes wedged in that damaged lining. After that lining inside your vein or artery is damaged, cholesterol, LDL cholesterol, tries to patch that up. It sticks in those damaged areas. The LDL cholesterol starts to oxidize the same way fat becomes rancid in your kitchen. Or if you cut an apple, you can see that it's nice and white, and then over time it becomes brown, right? If you just leave it out, that's oxidation, and that's what happens to the cholesterol that gets getting stuck in those cracks or those injuries inside your endothelium, or inside that lining, inside your artery and vein. The endothelial cell releases chemicals that tells the immune system damage has occurred. Okay, so there's damage inside the inner lining of your artery or vein, and those cells know that there's damage there, and they release chemicals that tells your immune system. Your immune system then sends white blood cells. These white blood cells are called monocytes to the area of the injury, and that starts the inflammation or the inflammatory process. Those monocytes, that part of your immune system, stick to the endothelium, so that inner lining, so your immune system stick to that inner lining. The endothelial cells, that inner lining, release more distress signals, turning those monocytes into what we call macrophages. Those are cells that can engulf and dissolve foreign invaders such as viruses and bacteria. It's all part of your immune system. But the macrophages, the things that can eat viruses and bacteria, they don't dissolve the LDL, okay? So they're there in case there was an infection in that area. And they'll kill viruses, they'll kill bacteria, but they don't dissolve the LDL cholesterol that's there. Instead, they get stuck in that cholesterol, and then it starts to build up. Those macrophages, your immune system, then they send out their own distress signals. So it's like a sergeant that's calling for more troops, right? They bring more white blood vessels, or white blood cells, and they arrive, and then those blood vessels get stuck in that HDL, that bad cholesterol. And this is the beginning of arterial plaque. And arterial plaque is a fatty deposit of oxidized LDL and dead macrophages, okay, part of your immune system. As the plaque continues to accumulate and inflammation continues, and inflammation-making immune factors called cytokines, these different cells continue to build up, they send out signals that attract even more immune cells. And this increasing, it just continues to increase the buildup in the plaque inside your artery. The plaque also attracts other substances that the body typically sends to the site of an infection, such as like fibrogen. That's a protein that helps the blood clot, right? So blood clots. And C-reactive protein, you'll notice that if you do have cardiovascular disease, you've been to your doctor, they will check your level of C-reactive protein because that's a marker for inflammation, and it's a risk factor. If you have high levels of C-reactive protein, then you may have cardiovascular disease, so it's a risk factor. So we're almost done here. So then the plaque just continues to breed more plaque, and the inflamed area also inflames cells nearby and starts the process again in those spots, and it continues to spread. And to protect itself, the body seals off that plaque, right? And it seals it off with a hard cap area that's composed of proteins, collagen, elastin, whatever. Your cells, basically, you try to seal that area off so it doesn't continue to build up. But what happens is beneath that cap, those dead cells are just sitting there and decaying, and pus builds up underneath that fibrous cap. And then, you know, the fibrous cap could stay in place, but it can thin and rupture. Then it spills pus and other toxins into the artery. That triggers the even more blood clotting factors, and that causes most heart attacks and strokes right there. Whenever that fibrous cap bursts, the pus comes out, and that triggers blood clots, and then bam, stroke and heart attack. So that's the cardiovascular disease. That's the process. So we have to understand that process in order to understand how we prevent and correct it. All right, so how do we prevent and correct heart disease? Well, I'm going to cover two things. There's a couple of very high risk factors that you have to stop. You have to realize you've got to stop doing, and we're going to cover both of those. And then I'm going to show you your body's secret weapon that your body uses against cardiovascular disease. And people who don't have cardiovascular disease have tons of this secret weapon right here. People that do have cardiovascular disease, they don't have very much of this secret weapon in their body. And I'm going to show you how and exactly what that is and how it works. So let's move right into the risk factors, okay? Now, obviously, being unhealthy, having unhealthy extra pounds, okay? So look, everybody has a healthy weight, and I'm not trying to make anybody a model here. Nobody needs to try to be crazy and lose weight to try to get on some kind of cover of a magazine. I'm not talking about that. I'm talking to being at your healthy weight, and that's because you want to be healthy, not because you want to look good. But listen, let me share something here that some very, very intelligent people have said before. Now, the heavier you are, period, the higher your risk of heart disease, and that's overweight. That's on top of your healthy weight, says a medical doctor there at Preventative Cardiology and Lipid Center in Temple University School of Medicine. While for many years doctors weren't exactly sure of the link between weight and heart health, recent studies including research published in the American Journal of Physiology in 2005, indicate that fat cells may act like a mini chemical factory, churning out a host of hormones and other inflammatory substances that increase your risk of heart disease. So So fat cells can sometimes drop toxins and other hormones that will actually damage that inner lining of your arteries and veins. And so people who are, unhealthy, have unhealthy overweight and fat tissue are at very high risk of heart disease. So we used to think that all adipose tissue, that's fat tissue, okay? We used to think that all fat tissue was basically neutral. But as it turns out, it's an active organ that makes all kinds of substances that we now know can cause or at least stimulate the atherosclerosis process. That's the plaque buildup inside your body, really. So your fat can actually damage the inner lining of the veins and arteries. That's why it's so prevalent amongst overweight people. So 1 pound of fat contains a mile of blood vessels that your heart has to pump blood through. That's why that if you're unhealthily overweight, then you're going to be higher risk for high blood pressure and those types of things, because every pound of extra weight, and that's a mile of blood vessels your heart has to send blood through. Even a minimal weight loss, even if you just lose a little bit, it can make an enormous difference. Your blood pressure will drop, your lipid profile, cholesterol will get better. It's remarkable how much good you can do for your body by just shedding a few pounds, says cardiologist Chuck McCauley, medical doctor, director of Marshfield Healthy Lifestyles Program in Marshfield, Wisconsin. He goes on to say, indeed, if you drop just 10 to 15 pounds, watch your blood pressure drop 10 or 15 points. Cholesterol levels, he said, respond even better. He has seen people drop their LDL, their bad cholesterol, from 160 down to 90 or 100 just by losing 10 pounds. So it makes a huge difference. He also says every inch and every pound you lose can add years to your life. And that's why you do it right there, guys. Not so you can look good, not so you can, impress anybody, but we want to be our healthy weight so that we can do our purpose and our calling here on the planet, so we can have a long, healthy life, so we can be there for our family. And so we recently, just a few weeks ago, did a healthy weight loss webinar. And because I don't want somebody going out there taking dangerous drugs or dangerous surgeries, losing weight. I want them to do it because they want to be healthy and do it the healthy way. So we have a healthy weight loss webinar. And if you call the number, that's our office. Gina can email you that actual webinar if you want that. The number is 281-664-2250. So leave us a message if it's after hours, but we can email you that healthy weight loss webinar if that's something that you want. On that webinar, you'll find out a very quick and easy healthy weight loss system called Dream Drops and Vima that we put together. And that's on that webinar. You can call our office if you're interested in that. People are losing about a pound a day, almost 30 pounds in 30 days, but they're doing it without drugs, without surgery. The Dream Drops just helps you because it decreases your appetite and it increases your metabolism a little bit. But people are losing a lot of healthy weight that way. Now, smoking is another major risk factor that you have to consider. In fact, almost 20% of all deaths from heart disease in the U.S. are directly related to cigarette smoke. Now, I put this in here because it's important, because cigarette smoke is not only affecting you if you're doing it, it's also affecting people around you. When you smoke, the people around you are also at risk for developing health problems, especially children. Environmental tobacco smoke, also called passive smoke or secondhand smoke, affects people who are frequently around smokers. Secondhand smoke can cause chronic respiratory conditions, cancer, and heart disease. It's estimated that nearly 70,000 non-smokers die from heart disease each year. That's a result, some kind of a direct result to exposure to environmental tobacco smoke or secondhand smoke. That's straight from WebMD there. So how does smoking cause heart disease? Well, basically the nicotine that's present in the smoke causes heart disease by decreasing oxygen to the heart. It decreases oxygen in your blood. It increases your blood pressure and your heart rate, which can damage that inner lining in the inside of your veins and arteries. It also increases your blood clotting factor. So if you have some heart disease already, you're going to be more likely to have blood clots, and that's where strokes and heart attacks can come from. It also does a lot of damage to those cells that line the arteries. That's what we talked about. It's called the endothelial cells. It damages those cells, and that's where bad cholesterol can get in those damaged areas and start to build plaque, okay? But here lies the cause and prevention of heart disease, that what we just covered, taking care of those cells in your veins and arteries, your blood vessels. we keep our blood vessels healthy, guys, we prevent heart disease, okay? So what's the secret weapon that can keep our blood vessels healthy? Here it is. The secret to keeping healthy blood vessels and preventing and beating heart disease is to increase the amount of nitrous oxide in your body. Now stick with me on this one, all right? Because this is important, and not a lot of people realize what I'm saying here. The endothelium, that's the cells lining the inside of your blood vessels, they make nitrous oxide. That's what their job and their function is. Nitrous oxide is a messenger molecule that tells the blood vessels to dilate or widen, okay? So it's like an expandable tunnel that allows more traffic to pass through. When you have enough nitrous oxide, the blood vessels relax and they widen. When you have enough nitrous oxide, the blood vessels, the blood flow flows to and from a healthy heart. When you have enough NO, that's what I'm going to call nitrous oxide. And when you have enough NO, there's less risk of toxic buildup of artery clogging because that blood is flowing. With enough NO, there's normal blood pressure levels because arteries are not tense and tight. And with enough NO, there's less risk of heart attack and stroke. But when you don't have enough nitrous oxide in your body and in your blood, the endothelium, that cells on the inner lining of your arteries and veins, begin to work poorly. And that's the first step to atherosclerosis or cardiovascular disease and breakdown of the heart and blood vessels. They will harden your arteries, they will clog your arteries, and that can lead to a heart attack and stroke if you don't have enough nitrous oxide. Now, here's the big question. So who has the most nitrous oxide? When do you have the absolute best and most nitrous oxide in your body? When you are fit. That's why fit people, that's why people who are in good shape do not have heart disease. So the number one way to increase nitrous oxide in your body is to exercise. That's it. Number one way to increase nitrous oxide in your blood vessels and keep your heart and your blood vessels healthy is to exercise. So remember when you've probably heard, right, how much are we supposed to exercise? You've probably heard people say, well, you need to exercise 15 to 30 minutes, 3 to 5 times a week, blah, 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 blah. That study that actually showed that was done in the 1960s, and people just continue to reiterate that and blah, 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 blah. Newer science, here's what it says. For best level health, for the absolute best health benefits, you should get 150 minutes of moderate intensity physical activity, such as a brisk walk. That would be moderate to moderate intensity exercise. But listen, a 30-minute brisk walk 5 days a week will fulfill that goal. You'll hit 150 minutes. But however you want to break it up, as long as you're getting at least 11 minutes at a time of exercise, you can break it up however you want. But to get the absolute best nitrous oxide release and health of your heart and blood vessels is to exercise 150 minutes a week. Now, you want to know how to release even more nitrous oxide? The second best way to increase nitrous oxide in your body is to eat more green leafy vegetables. Every time you eat green leafy vegetables, you release nitrous oxide in your veins and arteries. So get this, the number one and number two way to keep a healthy heart and arteries and lots of nitrous oxide in your blood is to exercise and eat right. Eat green leafy vegetables in particular and exercise 150 minutes a week, and that's how these people are staying healthy and they're preventing heart disease. That's how you do it. Every time you eat green leafy vegetables, you get that release of nitrous oxide in your veins and arteries. That's why these vegetables are so healthy for your heart. That, and they're also jam-packed full of all the other nutrients and synergistic enzymes, minerals, everything that God put in those vegetables to sustain life and to help you build life. And here's the list. I went ahead and did some study, and I put a list of best NO-producing veggies. And so it starts from, really just the greenest vegetable that you can get has the most nitrous oxide release, and it will help your heart the absolute most. So kale, spinach, Swiss chard, arugula, chicory, wild radish, bok choy, beets. Beets are great. Beets are absolutely great for releasing nitrous oxide. Chinese cabbage, the root juice, beet roots are great. Lettuce, cabbage, and mustard greens. Those are jam-packed full of nitrous oxide release, and that's going to clean out your blood vessels. It's going to keep them healthy. All right? Get this? Exercise, eat green leafy vegetables is starting to make sense. Here's some other good ways, though, to increase your nitrous oxide. There's been a lot of studies on each one of these, and they show that people who have the most nitrous oxide in their blood, the healthiest blood vessels, it's done by breathing deeply. Okay, you can increase your oxygen because NO, get this, nitrous oxide has oxygen molecules. In order for your cells in your veins and arteries to produce nitrous oxide, you have to have oxygen. So breathing deeply saturates your blood with oxygen and gives you the best chance of producing nitrous oxide. Drinking enough H2O, the O is oxygen, on water. You have to have enough water in your blood for it to clean out those toxins, for those endothelial cells to be functioning properly, and for them to have oxygen to make nitrous oxide. So you've got to be drinking at least 6 to 8 bottles of water a day. If you eat a lot of live foods, you eat a lot of fruits, you eat a lot of vegetables, maybe you can get away with 4 to 6 bottles of water a day because you're getting water through those live foods. But you've got to increase the water that you're drinking. Get enough sleep, and this is a big one. They've done studies, people who get 6 to 8 hours of sleep have healthier blood vessels and veins and higher levels of nitrous oxide. And one of our next webinars is going to be on how to get a great night's sleep. I'm going to show people how to do that because a lot of people have problems with that. Probiotics, that is healthy bacteria. A lot of the bacteria that you have, do you know you have more bacterial cells in your body than you do human cells? And that bacteria helps you break down nutrients. That bacteria also produces some nitrous oxide. So if you have good bacteria in your gut and you're taking probiotics, then you'll have more nitrous oxide. And by the way, stay away from antibiotics. I mean, if you can. I understand that I understand drugs are necessary in certain situations. But, I mean, if you can, stay away from antibiotics because that's going to kill your nitrous oxide levels. Saunas. That's actually been shown to increase nitrous oxide, heats up the body, produces vasodilation. And then also relaxation techniques and meditation. So relaxing a little bit will help your body relax and vasodilate with nitrous oxide. Now there's also a way to cheat a little bit, okay? And that's using a nitrous oxide supplement. Now you might recognize nitrous oxide because some bodybuilders use it because they understand it increases blood flow, increases nutrients to the muscles, and they pump iron and they lift weights with this nitrous oxide. Don't use that junk because a lot of it is mixed with a lot of other stuff that is not good for you. But there is a supplement that I do that I think is okay, and it's actually really good, and I've taken it myself, and that's at neogenis.com, neogenis.com. neogenis.com. And I don't get anything for sales of this, but I have read the book. You can buy the book there if you want to learn more about nitrous oxide. It's called The Nitrous Oxide Solution, and it's a really great book. You can see it there on the bottom right, and I have that book, and it's in our office. So, but you can also get test strips, so you can test the levels of nitrous oxide, and it's white if you don't have very high levels. It's light pink if you have higher levels, and it's red if you do have a strong level of nitrous oxide. And you can see as you take your supplements how it builds that up in your body. But look, it's not about doing supplements. It's about making your body or helping your body produce what it's supposed to produce by keeping it healthy. You can only cheat the body so long, and it's just not going to work. So I highly recommend that we start exercising, we start getting green vegetables in our diet, and we get adjusted, right? I mean, get adjusted regularly. We get our spine and nervous system checked because your brain and nerves, that nervous system controls every function in your body, even the smooth muscle on the insides of your veins and arteries. In order for you to be healthy, your body's got to be functioning properly. The system that controls the function of your body is your nervous system. So get in there. If you're not in our area, get in another chiropractic office, get your spine checked, get your nervous system checked, and get adjusted regularly. If you are in the area of Houston, then you can contact us at 281-664-2250 to set up your new patient appointment, or you can go to HoustonTXChiropractor.com to learn more about our clinic. But guys, that's the important thing, is that we maintain the health of our bodies because every single one of you out there has an innate intelligence inside your body that controls every function, and that intelligence is directed across the nervous system. So keeping it healthy will help keep you healthy. So I appreciate your time tonight. I hope you learned something on the webinar. If you have any questions at all, contact me, and just thank you for being here. All right? Y'all have a nice night.